My name is Dr. Tex Vermillier, and I'm the Vice President of Scientific Advancement for Ovation Fertility. And I'm going to speak a little bit about a study that we currently publish looking at artificial intelligence and how that correlates with a standard morphology grading system called the Gardner system. Now, in the laboratory, we often look at embryos down the microscope and we assign them a grade based on how the embryos look, whether they've got a nice inner cell mass, which is going to be the clump of cells that will lead to the baby, or whether or not they also have a nice trophectoderm, which are the outer cells that will eventually lead to the placenta. So we use a grading scheme traditionally to allow us to rank embryos based on what we feel by looking down the microscope, what we feel are these embryos' viability potential. What we're now able to use is some artificial intelligence technology that can identify things that we can't see down the microscope as humans. So by correlating this AI technology and identifying, based on their outcomes of viability that the AI algorithm is presenting, how that correlates with embryo grading morphology. What we've seen is that there is strong correlation between what the AI predicts as the embryo being viable and also what the embryologist is looking down the microscope and assigning a grade. But what also is quite impressive is that this technology has also allowed us to further identify which embryos are viable, and something that we may miss by looking down the microscope and assigning a simple morphology grade. So great correlation between these two technologies, but again, showing that this advancement in technology that we hope to soon be able to provide our patient gives us an additional tool to identify which embryos are more likely to be viable, therefore leading to greater success rates from our laboratories at Ovation Fertility.